In Fresno County, nearly 50% of residents have prediabetes or undiagnosed diabetes. Regardless of the type, diabetes is not curable yet. But Dr. Varsha Babu sits down to explain to us that patients can live a long, healthy, and happy life so long as they take care of their diabetes. Doctor, can you first explain to us exactly what is diabetes? And there are two types, is that correct?
Yes. So diabetes means you have elevated blood sugar, and our normal blood sugar is between 80 to 120. So when a person is diabetic, there we have different criteria we use to diagnose diabetes. So their blood sugar first thing in the morning, we call it fasting blood sugar, will be greater than 126, or sometimes if we check it randomly, meaning any time of the day, if it's greater than 200. We have two types of diabetes mostly, and then there is a third variety called monogenic form, which is mostly genetic related. So type 1 diabetes means it's an autoimmune condition where your insulin production is completely gone. So they are completely insulin dependent, meaning they need to be on multiple shots daily and they need two different kinds of insulin. So that's type 1 diabetes. Type 2 diabetes means it's insulin resistance. So what insulin resistance means is in type 2 diabetics, usually what happens is they need more insulin to bring down their blood sugar.
How does one know if they are diabetic?
So one of the most common presenting symptom is fatigue. You know, sometimes people get really tired, okay, because our body is used to that normal range of 80 to 120. Then your blood sugar starts rising. They get very tired, and the other symptoms are they get really dehydrated. So diet, exercise can actually make massive changes in your control. We have patients with blood sugars in 300 to 400. Wow. A motivated patient can just be normal in 3 months, just by diet, exercise, if they follow it very very thoroughly, or like I would say diligently. So I would say keeping up with doctor's appointments, and then working with and if they have a diabetologist or some endocrinologist, you know, working with the endocrinologist will help. And I usually recommend if they are very tech savvy patients, like, you know, apps like MyFitnessPal or CalorieKing.com, which basically help them to portion control, how to cut down the starch, and just to have like regular exercise plan, and if they are on medications, take them regularly.
Thank you very much for your time.
Yes.
Dr. Babu, thank you. According to the American Diabetes Association, new cases are popping up every day. 1.5 million Americans are diagnosed with the disease every year.